Thank you for joining today's webinar where we're going to cover non-surgical regenerative injection therapies for all stages of osteoarthritis. I'm Jason Griffeth. I'm a founder, clinical director, and stem cell scientist with the Regenerative Biologics Institute. And a little bit about myself. I started in the field of regenerative medicine back in 2003. Back then we were using a patient's own stem cells to treat congestive heart failure. And we would take a patient's tissue sample. We would bring that tissue sample to our laboratory. We would isolate the stem cells and then grow them out for a few weeks and then send them back to the hospital where we would directly implant them into the patient's heart wall using a minimally invasive catheter. And we were in clinical studies all over the country, including at Mayo Clinic, Scripps Research Institute in California, Cleveland Clinic, University of Florida, and a number of other sites. But really, those clinical trials were largely successful, and about 2/3 of those patients got significantly better, and their quality of life improved dramatically. But in 2008, 2009, when the economy collapsed, the funding for those clinical trials collapsed as well. So me and a few colleagues actually launched a new program where we could take a patient's tissue sample, we could isolate the stem cells quickly at the point of care or at the patient's bedside essentially, and give those stem cells back to the patient quickly. And we didn't really need to grow them out for that 2 to 3 week period like we did before. So we launched that program in 2010, and we've been treating many patients, mostly with orthopedic conditions, since that time. Here is the rest of RBI's team, Dr. Brett Hockey and Dr. Felice Hockey. I will tell you a little bit more about what they do later, but really RBI's team is composed of scientists and physicians that work together to ensure patients receive the best possible treatments, and we're really one of the few clinics in the entire country that have both scientists and physicians working together. So what is regenerative medicine? Really the concept behind regenerative medicine is the process of replacing or regenerating cells and tissues to restore their normal tissue function. The field holds the true promise of treating the underlying cause of conditions rather than just treating the symptoms, and it really can dramatically improve the way that we live and the way that we age. So as far as what types of regenerative therapies are available, there's a number of them out there, but really in the United States, the only way to get true stem cell therapy where there's living, viable, functional cells is through your own tissue sample. And there's a few different types of stem cell therapies. One is derived from fat tissue, and then the other is derived from bone marrow. And then, of course, we have our proprietary blend of stem cell treatment, which we refer to as the Trugenta injection therapy. And I'll tell you more about that later. But all of the other therapies that some clinics spin as stem cell therapy are really growth factor therapies. They do contain growth factors, but they don't have any living functional stem cells in them. And those include umbilical tissue therapies, placental tissue therapies, amniotic therapies. PRP therapy is a good growth factor therapy that we use quite often. And then the new kid on the block is exosome therapy. And we'll talk a little bit more about all these in a little bit. So what are stem cells? Stem cells are the body's natural repair cells. They are multipotent, which means they can differentiate into a variety of tissues. They exhibit what's called plasticity, so they tend to form whatever type of cell they come in contact with. So if we put them into near cartilage, they tend to form new cartilage. We put them into a tendon, they tend to form new tendon. But beyond that, the stem cells are naturally anti-inflammatory, they're anti-fibrotic, and they're angiogenic, which means they can stimulate some new blood supply in the areas that we inject them. And stem cells can also be considered therapeutic protein delivery vehicles that have profound clinical use. Another regenerative therapy, as I mentioned, that we oftentimes combine with stem cells is platelet-rich plasma. Platelet-rich plasma is derived from your blood. We take a blood sample from patients, we concentrate the platelets, and those platelets have lots of growth factors that can stimulate healing and repair. They can also be used in combination with the stem cells to enhance healing. And there's a number of PRP therapies available. We really work hard to optimize our PRP treatments for healing, which means we remove a lot of the white blood cells. Having a high number of white blood cells in the PRP can produce inflammation and limit the healing that it can do. So we try to get rid of as many of the white blood cells as we can, and of course harness as many of the platelets that we can, which have all those growth factors in them. And then, like I said, we combine stem cells with PRP when we're doing orthopedics, and that enhances the efficacy of it. This PRP can act as a biological scaffold for the cells. It can also release additional cytokines and growth factors. But working together, the stem cells can decrease pain and inflammation, stimulate new blood supply, activate resident stem cells, and recruit other stem cells from around the body. It can protect other damaged cells from dying off. And the ultimate goal, of course, is to regenerate and heal the injured or diseased tissue. And what we want to talk about today is kind of, which of these regenerative therapies do you want to use in these different stages of osteoarthritis? So we'll get into that a little bit. And of course, you have your traditional ways to treat arthritis, pharmaceuticals such as painkillers, cortisone shots, epidurals for backs, surgery such as joint replacements, chiropractic, physical therapy, and some other things. Of course, a lot of the patients that come to see us are looking to avoid a lot of those things. And there's research out there to suggest that the traditional treatment options are just not very good. This was a study published a couple years ago about arthroscopic surgeries, where they compared an arthroscopic surgery for knee arthritis and meniscus tears. They compared it to a placebo, and they showed that the arthroscopic surgery provided no lasting pain relief. And actually, 3 months after the procedure, fewer than 15% of the patients experienced any pain relief at all. And then steroid shots. Many people get steroid shots or cortisone shots when they have pain, and sometimes you really need it, especially if you have a function that you need to attend and you want to get rid of that pain quickly. But cortisone, of course, only masks the symptoms and doesn't do anything to treat the underlying cause of the pain. And according to Tufts Medical Center, multiple shots of cortisone resulted in greater loss of knee cartilage in a study that they did. So we don't recommend doing too many cortisone shots if you can avoid it. This was another study that came out about the cortisone shots, and really kind of disturbing, where it accelerated arthritis progression, it caused osteonecrosis and rapid joint destruction, including bone loss. So definitely try to avoid those. And of course, our philosophy is that regenerative therapies are the best way to help patients sustain their health and retain their ability to be active for as long as possible in life. And as you saw earlier, these are the types of regenerative therapies that are available, and we'll go into those a little more detail here. But our goal at RBI is to give patients the most functional living stem cells possible. And the results or the studies are showing that adipose tissue or fat tissue is the richest source of stem cells in the body. In fact, it can have up to 500 times more than bone marrow. And then, of course, the birth tissue stem cell therapies out there don't have any viable functional stem cells in them. We like to show patients this slide where, we just basically took a picture of, these birth tissue growth factor products that we get and compare that to a patient-derived tissue sample where there's, as you can see, millions of stem cells and a pellet at the bottom there, where the vials of these birth tissue products that we get, there's no stem cells in them. You can't see a pellet, but like I said, there are growth factors in them, and they can be useful for some things. This slide just shows, if you try to grow these products out in the laboratory, where you basically feed them fertilizer or growth factors in the laboratory. When we do that with a patient's own stem cells, we get very robust millions of stem cells that grow in the culture flask. Or if we take some of these birth tissue products, we really can't grow any of them out. So what does that mean for patients? Growth factor therapies can provide a short-term anti-inflammatory effect and can stimulate some healing. We use growth factor therapies more for acute type injuries like tendonitis or if you got tennis elbow and things like that. But really for any chronic degenerative condition, especially late stage osteoarthritis, you really want stem cell therapies that can provide both an anti-inflammatory effect and a long-term regenerative effect. And as I mentioned earlier, this is RBI's proprietary regenerative injection therapy, and like I said, the goal is to provide as many stem cells as possible to patients to give them that long-term regenerative effect. And at RBI, we always use ultrasound guidance so we can get the cells directly into the area that we need them. So what are the benefits of these regenerative injection therapies? Well, they're natural with no side effects. They're minimally invasive, non-surgical, so there's little recovery time. Patients come into our clinic, they get the treatment, they're there for about a total of 2 hours, and then they walk out as they walked in, maybe with a little stiffness in their joints from where we injected them, but pretty much pain-free procedure. For some patients, we like to optimize their body through precision medicine, and Dr. Felice Hockey is our precision medicine specialist. But basically, what she does with some of our patients is she helps them move away from inflammation through bioidentical hormone replacement therapy. Sometimes as we age, our hormones get a little bit out of the optimal range. So she can help you get those back into the optimal range. And of course, our hormones control nearly everything in our body, from the way we feel to our energy levels, to the way that we heal. Many things. So it's good to get those optimized. And then there's things that we offer that not a lot of other clinics offer, including peptide therapy, which can help with healing of soft tissues and tendons and ligaments. And then Dr. Hockey also works with patients to help them with their diet and getting them on a low inflammatory diet. And then we have medical grade supplements available as well. But for some patients, we really work with them to optimize their body, and then we will inject them with this regenerative medicine treatments, and that's just going to give them a much better chance at a clinical benefit. This is one of the patients that we recently treated that went through the Dr. Hockey's optimization program and also got treated with Tragenta injection therapy. She was a 64-year-old patient that she was told she needed knee replacements, but she came to us because she really wanted to avoid that. And when she went through our program and received the injections on both knees, you can see by her quote that her knees feel great. She's been able to stop taking her Celebrex, and she's back to enjoying her life and her retirement, and most importantly, avoided that joint replacement surgery. As far as the areas that we treat at RBI, nearly any joint, knees, shoulders, hips, also the spine and back, even hands and wrists. We get a lot of patients with thumb arthritis. The most common things that we treat are our knees and hips, followed probably by shoulders. So I'd like to go over a little bit of the clinical data with you. This was a major clinical data. This was a big study, I should say, in 1,128 patients where they were treated with adipose-derived stem cell therapy, and patients gradually improved from 3 to 12 months after treatment. And that's kind of the interesting thing about regenerative therapies is, yes, some patients can get an anti-inflammatory effect within the first few months, but really the long-term regenerative effects do take a little while to kick in. And in this study, it showed that as well, and over 90% of the patients improved after the treatment. Some of these studies do show before and after x-rays where they were able to show a widening of the joint space, which they attributed to greater cartilage formation. This is a great study where it was a randomized double-blinded placebo-controlled study, so that means the patients did not know if they were getting a placebo injection or a stem cell injection, and the doctors did not know what they were giving the patients. And they did before and after MRIs on every single patient, which is the best imaging available. So in this study, they were able to show a significant improvement in cartilage volume for patients that were treated with the stem cells, as opposed to a worsening in the patients treated with placebo. This is a study which use adipose-derived stem cells to treat patients over the age of 65. So we get some questions that if I'm older, can the stem cell treatment work for you? And this study shows that it clearly can. And most of the patients in this study did improve. And at RBI, we've treated patients in their 90s that have improved. So this is actually one of them. I like showing this slide because we can't always see directly into the joint to see the healing taking place, but you can clearly see on a patient's skin what can happen. But this was a 93-year-old woman who came in to get her knee injected, but she had this big bandage on her lower leg, and we asked her what is going on there, and she said, well, I've had this big wound for about the past 6 months, and nothing, hasn't been able to heal it. I've been to multiple doctors, and nothing they have done has taken care of it. So I said, well, while you're here, we can treat that wound with some of your stem cells and your platelets, and it should heal it. So she elected to do that, and as you can see on the bottom left, this was about 4 weeks later, and then about 6 weeks later on the right there where, that wound is pretty much completely healed. And this is a wound that, traditional options were not treating. This is an example of the questionnaire that we have patients do before and after treatment to get an idea of how their pain level improves over time. But this was an interesting case, and where this 86-year-old patient was a bone-on-bone patient. Of course, he was told he needed joint replacements. He actually had a friend at the same time that was told he needed joint replacements. And the patient that we treated, had anywhere from moderate to extreme pain before treatment, and then 8 months later, he was pretty much pain-free. But his buddy that elected to go through with the joint replacement therapy at the same time was actually still in great pain at the 8-month mark. So this was a great case. We treated a lot of different patients over the years, a lot of from all ages. This was a patient that had a torn meniscus, actually in multiple areas. So she had multiple tears in her knee. But she needed help walking from our lobby back to the consultation room. But after treatment, she's doing quite well and walking all over Manhattan. This is another patient, bone-on-bone knee arthritis. Just wanted to get back to playing pickleball. He refused to have joint replacements as well. So we treated him, and he was back to playing pickleball within a week or so. We've treated a lot of former military. They come back pretty banged up, and then they usually have multiple areas, whether it's both hips, both knees, some both knees and their back. And we also treated NFL players like Eddie George, former Heisman Trophy winner and NFL running back. He came back. His knees were pretty banged up from playing 9 years in the NFL. We treated him, and he's done really great. And in summary, our bodies have incredible healing ability in the form of stem cells and platelets, and by using these stem cells combined with the PRP, we can stimulate the body's natural healing and put it directly into an area of need. The cells are naturally anti-inflammatory and pro-healing, and really one of the only available therapies that have the potential to treat the underlying cause of your condition as opposed to just treating the symptoms. They have the ability to substantially reduce pain and improve your overall quality of life, and it comes with little side effects, and it's all minimally invasive, non-surgical procedures that require little downtime. So appreciate you guys joining the webinar again. If you have any questions, you can email us at info@rbistemcell.com. Our phone number is listed here too. You can call us and be happy to answer any questions that you guys have. And then you can find additional information on rbistemcell.com. So thanks again.